Dr. Kenneth Norwood specializes in ADHD treatment at the University of Virginia. He's here to talk a little bit about it. First of all, ADHD, what does it stand for?
ADHD stands for Attention Deficit Hyperactivity Disorder.
And what, just for people who don't know, I know a lot of parents know about ADHD, but talk a little bit about what that means to be diagnosed with it.
So first of all, ADHD is a neurologic disorder. It's a brain-based disorder. And these are children who have trouble focusing, paying attention, staying on task. They're disorganized, they're forgetful, and in some cases they're impulsive and hyperactive.
So, you know, we used to hear about ADHD years ago, not very much. And a lot of us even say now, those of us who know about it say, gosh, I don't even remember a child in my school. But now we hear about it a lot more. Why is that, do you think?
In part, it's because we're doing a better job of diagnosing it. It's been there all along. But for sure, the prevalence numbers have been increasing over the years. 25 years ago, it was 3 to 5%. Now it's 8 to 10%. And so there are some real concerns that it could be truly increasing in prevalence.
What is the thinking on why that's happening?
Well, for one thing, we raise our kids differently than we used to. Our kids are in front of computers at an early age. They're in front of television at an early age. They're not outside playing like they used to. They're indoors. There certainly are concerns about what might be going on in the environment. Are there things in the air? Is there things in our diet that could be having an impact? A lot of this needs to be sorted out.
So if it goes undiagnosed, say a parent just says, no, you know what, we're going to fix this, we're going to, you know, teach them how to focus, all of that stuff. Are there long-term effects if it goes undiagnosed?
Yes, there are. There's significant long-term effects.
What are those?
First of all, children with undiagnosed and untreated ADHD have increased school failure. They're more likely to drop out of school. They have trouble making and keeping friends. They have trouble being successful in extracurricular activities. And then as they get older, there's a much higher prevalence of drug, alcohol, and tobacco use in the teen years and in the young adult years, a risk of anxiety and depression. Also more accidents. Teenagers with ADHD are more likely to get in motor vehicle crashes. And even as adults with ADHD often have trouble keeping jobs. They have trouble maintaining relationships, maintaining marriages.
So definitely important to get it diagnosed. Dr. Ken Norwood, thank you so much for coming out here today. We really appreciate it.